So when our body is infected by any bacteria or virus, it is being first phagocyte by macrophage, then it recruits the immune cells, that is the T cells and the B cells. What does the T cell does? T cells are cytotoxic cells. They help in killing of bacteria, and B cells, they produce antibodies which acts against the bacteria. Now even after the infection is completely gone, some amount of T cells and B cells remain in the system as memory cells. What for? If there is any further infection, these T cells and B cells mount immunological response. So this is generally about the immunity. Now this principle is being used in vaccines. So types of immunity, there is this active immunity and passive immunity. So let's see the flow chart. Innate immunity, which is present at birth, and there is this acquired immunity. So acquired immunity, there is this active immunity and passive immunity. So there is this active immunity and passive immunity. So active immunity, just now what I have said, that there is a infection that leads to immunity, and passive immunity is when you receive some ready-made antibodies. Now how these ready-made antibodies are made? First, a horse is being subjected to antigens, small doses of antigens. The immune system in the horse produces antibodies. Now the horse serum is collected and antigens are being extracted from that serum. That is the Antisera. So when that is being injected in a human, that is the passive immunity. So acquired immunity, active immunity is natural due to a clinical or subclinical infection. What do you mean by subclinical infection? So subclinical infection when there is no clinical signs and symptoms, but infection is there in the body, but that leads to triggering of the immune system. And then there is the artificial infection, that is vaccine. So in vaccine, either dead virus or dead bacteria or some component, antigenic component of the virus or bacteria is being introduced into the body to stimulate the immune system. That leads to active immunity. So in which case there will be no active immunity. So in which case there will be no immunity. So passive immunity, just now I have discussed, these are Antisera derived from horse serum. So what may be the adverse effect? Well, visit the word. Allergic reaction. So it's a foreign protein, alright, derived from horse. So that may lead to allergic reaction. And what is passive natural immunity? That is the antibody the baby receives from his mother via the placenta. That is the natural passive immunity. So vaccines are biological preparations, consist of whole microorganism or its products that impart active immunity by stimulating the immune system. So what will happen if the immune system is absent? In which case the immune system may be absent. Well, RC immunocompromise. Alright, in immunocompromise, the immune system is absent. That may not lead to proper immunity. Which condition immunocompromise? Kichu condition bol? Jore bol. HIV. ঠিক আছে? So then there is the Antisera. So Antisera are purified and concentrated preparation of serum of horse actively immunized against specific antigen. Any example you know of Antisera? বল বলতে চাইছিস কিছু? So there is this polyvalent snake anti-venom, that is an Antisera. Then immunoglobulins are separated human gamma globulin which carries antibodies. ঠিক আছে? বুঝলি? So type of vaccine, there may be killed vaccine, then there may be live attenuated vaccines, or there may be toxoids or component. ঠিক আছে? Okay. So contraindications of live vaccines. Leukemia or other malignancy receiving cytotoxic drug. So in leukemia, there is abnormality of white cells. Alright. So immune response may be absent. So these are live vaccines. It may not cause any harm in normal people with normal immunity. But in case of immunocompromised persons, these may lead to infection. Alright, vaccine induced infection. Corticosteroid recipient. What does corticosteroid do? Well, immune suppression. Alright. Then HIV, like RC has said, these are immunocompromised person. SLE, another autoimmune disease. So these are contraindications of live vaccine, because the bacteria or virus within the vaccine may lead to infection in this individual. BCG vaccine. BCG vaccines comes as a short note in examination. ঠিক আছে? So vaccine in general is treated, is studied more vividly in the community medicine and in the microbiology. So here we are studying is as a drug. Is vaccine a drug? Bol. What is a drug? Anyone? Well, Pritam bol. What is a drug? বসে বল। ওরকম বললে হবে না, WHO definition. Anyone? Why? সব না। So vaccine is a drug. It's a substance or a product, alright, that is used to modify the immune system for the benefit of the individual. So it is a drug. বুঝলি? So BCG vaccine. So BCG vaccine, what is it used for? So BCG vaccine is derived from inactivated Mycobacterium bovis virus, bovis bacteria. Alright, inactivated Mycobacterium bovis bacteria. So where it is given? It is given in the left deltoid. So most of you will have a scar in the left deltoid. That is due to the BCG vaccination. So what does BCG vaccination do? Does it prevent the tuberculosis? So BCG vaccination does not prevent tuberculosis. Rather, it prevents extreme forms of tuberculosis. By extreme forms, what is mean by extreme forms? The complication that arise due to tuberculosis. That is prevented by the BCG vaccine. Another repurposition of drug, BCG vaccine nowadays is used for treatment of carcinoma of bladder. That is being treated by BCG vaccine. Alright, BCG vaccines comes as a short note in pharmacology, so get it prepared. ঠিক আছে? So live attenuated Mycobacterium bovis given at birth, given intradermally, 0.1 ml in the left deltoid, that produce the scar in your left deltoid region. Then prevent extreme form of TB, therapy for carcinoma bladder, contraindicated in immunocompromised. Why? Why it is contraindicated? It's a live vaccine, so contraindicated. Pertussis vaccine. What is pertussis? Whooping cough. ঠিক আছে? এই মাইক্রোবায়োলজিতে কিছু পড়ানো হয়নি এগুলো? তো শেষ হয়ে যাওয়ার কথা, তাহলে কেউ কিছু বলতে পারছে না কেন? সো কিল pertussis bacteria. ঠিক আছে? Triple antigen. What are other two antigen? Have you heard this term, triple antigen? তো শোনেইনি? এই ডিপিটি কেউ শোনেনি? Strange. Also a component of pentavalent vaccine. It is given deep IM injection. Alright. So given at 6, 10, 14 week after 4-week interval. Why this 4-week interval is maintained? Anyone? সবাই তো চুপচাপ কেন? So 4-week interval for proper stimulation of the immunity. Then adverse reaction, pain and fever. There may be fever in the child. ঠিক আছে? And pain at the site of injection. Rarely convulsion. So contraindication, any neurological deficiency. Now Haemophilus influenzae type B vaccine. So what is it? Conjugated vaccine containing oligosaccharide of Haemophilus influenzae. So this is a component of the Haemophilus influenzae bacteria. ঠিক আছে? Protection against meningitis, pneumonia in infants and in children. Part of pentavalent vaccine. Pentavalent vaccine কি আছে? Pentavalent vaccine কেউ শোনেনি? এই এখানে ইয়ে হয় না, ভ্যাকসিনেশন হয় না কমিউনিটি মেডিসিনে? তো দেখাওনি কি হচ্ছে কি না হচ্ছে, ঠিক আছে? So which condition you give this pentavalent, give this Haemophilus influenzae, this vaccine in chemotherapy during hemopoietic stem cell transfusion, ঠিক আছে? During asplenia. What is asplenia? Anyone? Huh? And there is surgical removal of spleen. So what is spleen important for? Huh? Pritam kichu bolte chahiche. So spleen is the storehouse of the immune cells. So in asplenia there is decrease in immunity. Then splenectomy, then HIV infection. In HIV infection, the subject may be susceptible to this Haemophilus influenzae type B bacteria infection. So it is given. Pneumococcal vaccine, capsular polysaccharide. So another component vaccine, ঠিক আছে? So prevent invasive pneumococcal disease by Streptococcus pneumoniae. The Streptococcus pneumoniae হয়েছে? Have you heard of this term, Streptococcus pneumoniae? হ্যাঁ, হোয়াইট হয়েছে? কেউ কিছু বলছে না কেন? সো পার্ট অফ পেন্টাভালেন্ট ভ্যাকসিন। তাহলে পেন্টাভালেন্টে কি কি থাকে? বল অংশুমান, বল পেন্টাভালেন্টে কি কি থাকে? হ্যাঁ তুই তো, তোর নামই তো অংশুমান, তাহলে ভাষ্য, হ্যাঁ বল, জোরে বল। পেন্টাভালেন্টের 5টা কম্পোনেন্ট কি? হ্যাঁ পার্টুসিস, বল। তারপরে হ্যাঁ ডিপথেরিয়া, পার্টুসিস, টিটেনাস। তারপরে আর কি বললি? হিমোফিলাস ইনফ্লুয়েঞ্জি। হ্যাঁ ঠিক আছে, বস। তো সবাই এরকম কোনো রেসপন্স নেই কেন? ওরাল পোলিও ভ্যাকসিন। So the other vaccines, these were given deep intramuscular injection, ঠিক আছে? So this is a oral vaccine. So polio vaccine, what is this polio vaccine? Polio vaccine is a live attenuated vaccine, ঠিক আছে? Live attenuated vaccines. So what advantage do we have with this polio vaccine? Now this oral polio vaccine, when they are given to the baby, they stimulate the lymphatic system of the gut. So there is stimulation of the gut immunity, and also there is stimulation of the immunity of the body. And also these live attenuated virus, these are passed in the stool. So what happened? There is something known as herd immunity. What do you mean by herd immunity? These bacteria that pass on with the stool, they will go in the environment and impart immunity to the other person who are not immunized. This is known as herd immunity. Have you heard of this term, herd immunity? Huh? So it provides herd immunity because it's a live attenuated vaccine. So, live attenuated vaccine easy to administer. Why? Given orally. Then at birth 6, 10 and 14 week have this 4-week gap between them. Systemic and intestinal immunity. So, there will be stimulation of the lymphocytes in the gut and also immune system of the body. Then there will be herd immunity. Have you heard of this term, pulse polio? শুনেছিস? এত অ্যাড দেয়, এত ক্যাম্পেইন হয়, কোনোদিন শুনিসনি পালস পোলিও? Some day is selected in which all children are given this oral polio vaccine. Usually during February, I think that day is selected, and all the children, irrespective of their vaccination status, is being given this oral polio vaccine. It is the pulse polio. দেখিসনি এত ক্যাম্পেইন হয়, এত বুথ থাকে রাস্তাঘাটে, কোনোদিন দেখিসনি? So inactivated poliomyelitis vaccine. So basically it's a inactivated virus, all right, given either by given parenterally. The earlier that was orally, this one is given parenterally. The immune response of this parenteral vaccination is more than that of oral vaccine. Earlier it was only oral vaccine that was given in national immunization schedule. Now this parenteral vaccination is also being introduced. ঠিক আছে? So inactivated virus injected subpart. So there will be fever and pain. Having fever and pain, is it a good sign or a bad sign? When do you have fever? So when there is an immune response, you are going to have this fever and pain. So if you develop fever after vaccination, so it points that your immune system is being activated. All right. So having fever is a good sign that your immune system is working well and your immune system is being activated. ঠিক আছে? Hepatitis B virus. So how does hepatitis B virus spread? হয়েছে তো hepatitis B virus? বল, how it is transmitted? Wide sexual transmission and জোরে বল, blood transfusion আর transplacental. ঠিক আছে? So in any body fluid, by any body fluid, hepatitis B may be transmitted. So hepatitis B may be more dangerous than any other disease. ঠিক আছে? So people who are at risk of being hepatitis B transmission, কারা at risk? এই হেলথ কেয়ার ওয়ার্কার, ঠিক আছে, নার্সেস, doctors, they are at risk of being hepatitis B transmission. And what can hepatitis B do? কি করে? বল, কিছু বলতে চাইছিস? আরসি, হেপাটাইটিস বি কি করে? এত ইয়ে করতে হচ্ছে কেন? হেপাটাইটিস বি লিড টু সিরোসিস অফ লিভার. তা কোনোদিন শুনিসনি? দেখিসনি সিরোসিস অফ লিভার? পড়িসনি কমন কজ অফ সিরোসিস অফ লিভার? একটা অ্যালকোহল আর একটা হেপাটাইটিস বি, ঠিক আছে? সো এভরি হেলথ ওয়ার্কার or student of MBBS should be, or nursing should be immunized by for hepatitis B. If you haven't been immunized till now, get it done. Patient দেখিস না, আর কি বলবো। So what is the component? Hepatitis B virus surface antigen কি, কতগুলো অ্যান্টিজেন থাকে? হ্যাঁ, জোরে বল। সারফেস অ্যান্টিজেন কোনটা? হ্যাঁ, HBS স্যার, ঠিক আছে। given at birth at 1 month and 6 months, and also if you want to get immunized, you can get it at this age also. It is for any age, given in IM injection. So how this hepatitis B virus is being prepared? It is prepared by recombinant DNA technology. So this surface antigen, this gene for this surface antigen is incorporated into the yeast, and the yeast starts to produce this surface antigen, and this surface antigen is then injected into the body. That leads to immune response. That is how immunity is obtained. ঠিক আছে? So any person having immunized will have it HBsAg antigen raised. ঠিক আছে? If you want to check your hepatitis immunity, get your HBsAg antigen. It will be raised even without having any active HBs in having any hepatitis B infection. If you are immunized, your HBsAg will be raised. ঠিক আছে? So কাদের দেওয়া হয়? Children, all healthcare professionals. Hemophilia. Why hemophilia? Hemodialysis, drug addict, they all must be immunized with hepatitis B vaccine. ঠিক আছে? Rotavirus. What does rotavirus cause? Diarrhea. Diarrhea in babies. ঠিক আছে? Diarrhea may be a cause of mortality for the children. So rotavirus vaccines prevent severe watery diarrhea. What is it? Inoculated vaccine given orally 6, 10 and 14 weeks. One of the important complication is intussusception. What do you mean by intussusception? Anyone? Surgery te keu jay na? No. Sir. Mumps virus. Mumps, which organ it infects? Mumps. কোন অর্গান ইনফেক্ট করে? নো রেসপন্স। ঠিক আছে? লাইভ অ্যাটিনুয়েটেড ভাইরাস grown in cell culture of chick embryo. It's a component of MMR vaccine. MMR stands for mumps, measles, rubella. ঠিক আছে? These three are injected together. Protection for 10 years given subcutaneously, and it will cause adverse effect. There will be maybe fever. Measles vaccines, another component of MMR. These are live attenuated vaccines grown on chick embryo. Protection for 8 years, causes febrile convulsion. So in which case it should be given with care. So any neurological deficit, you have to be careful with the MMR vaccine. Rubella vaccine. So another live attenuated vaccine. There may be again fever, malaise, lymphadenopathy. It's a component of MMR vaccine. Tetanus toxoid. When is tetanus toxoid given? কেউ নেয়নি কোনোদিন টিটেনাস টক্সয়েড? কখন দেওয়া হয়? হ্যাঁ, জোরে বল। হ্যাঁ, টিটেনি। তো টিটেনি হয়েছিল তো কেন দেওয়া হয়? ইনজুরি, ঠিক আছে, ডিপ কাট ইনজুরি, রোড ট্রাফিক ইনজুরি, ঠিক আছে। ইন দিস কেস this tetanus toxoid is given. This is a component, this is the toxoid of the tetanus bacteria is used for vaccination, ঠিক আছে। and আর কাকে দেওয়া হয়? given in pregnant women. তাহলে formalin treated exotoxin of Clostridium tetani given IM. Emergency te jas? Have you gone to the emergency? Injury niye ele to prothom jinishta deয় হচ্ছে tetanus injection দেয়, IM injection দেয়। দেখেছিস? দেখেও নি, ঠিক আছে। Injury likely to produce tetanus bacilli, likely to introduce tetanus bacilli, also given in pregnant women. গাইনিতে দেওয়া হয় না প্রেগনেন্ট উমেনদের? ঠিক আছে। diphtheria toxoid, so it acts against diphtheria, ঠিক আছে, DPT the component. Rabies, rabies caused by বল, অনুষ্কা বলছে কিছু। হ্যাঁ, and how? From bite of rabid animal, ঠিক আছে। That's how rabies virus is transmitted. Now if rabies occurs to you, it is almost 100% fatal. So rabies virus is a life-saving virus. You must give rabies virus before rabies happens to you. That is, after being bitten by the rabid animal, you give rabies virus. It can also be given prophylactically. কাদের দেওয়া হয় prophylactically? কাদের দেওয়া হয়? So for dog handlers, all right, for animal lovers, for people having pets, for them rabies vaccine may be given prophylactically so that you don't get rabies after being bitten, ঠিক আছে। How it is prepared? From purified chick cell, purified chick's embryo cell. It is cultured in purified chick embryo cell. So hence the name purified chick embryo cell vaccine. এই রেবিস হয়েছে তো মাইক্রোবায়োলজিতে? হয়েছে তো? বল রেজিম বল। রেবিস ভ্যাকসিনের রেজিম মাইক্রোবায়োলজিতে আসে? এনিওয়ান? পড়াশোনার খুব খারাপ অবস্থা। রেবিস ভ্যাকসিনের রেজিম মাইক্রোবায়োলজিতে আসে। Then human diploid cell vaccine, purified varicocele rabies vaccine. So these are the culture in which the rabies vaccine is being raised. Alright, hence the name. Earlier there were neurological vaccines. Nowadays neurological vaccines are not being given. Usually the culture vaccine, these are being given. So pre-exposure prophylaxis. Pre-exposure prophylaxis means before bite is happening, you give prophylaxis. কোথায় দেওয়া হয়? Veterinary doctor, animal handler, animal lover. ঠিক আছে? Dose 0.1 ml, 1 ml intradermally on 0-7-28 days, followed by booster every 2 years. আছে নাকি animal lover? No. So you don't require such vaccines. Post-exposure prophylaxis. So when the dog has bitten you, dog or any rabid animals has bitten you, তাহলে কি দেওয়া হয়? 0.1 ml intradermally at 2 site on 0-3-7, followed by 1 site on 28 and 90 days. এই রেবিসের ভ্যাকসিনেশন কিন্তু আসে, মাইক্রোবায়োলজিতে আসে অ্যাটলিস্ট, ফার্মাতে না আসলেও। পোস্ট এক্সপোজার প্রোফাইল্যাক্সিস, প্রি এক্সপোজার প্রোফাইল্যাক্সিস কিন্তু আসে, ঠিক আছে? কেউ কিন্তু কিছু পড়ছে না, আনসার কিন্তু পাচ্ছি না। তাহলে কি, 0-তে হচ্ছে 2 at 2 sites, ঠিক আছে? 3-তে হচ্ছে 2, 7-এ 2, 28-এ 1, 90-তে 1, 0.1 ml intradermally. The route is important. It is given intradermally. Anti-rabies serum. So what is the anti-rabies serum? কি? rabies immunoglobulin, ঠিক আছে? So concentrated and lyophilized serum from horses hyperimmunized by repetitive injection of rabies vaccine that produces antibody against the rabies, ঠিক আছে? So rabies, anti-rabies immunoglobulin, এটা কি করে, কোথায় দেওয়া হয়? Local infiltration at the site of injury, where the bite has taken place, you give it at that site, local infiltration at the site of injury, and the rest you give it IM. Nowadays it is recommended the entire immunoglobulin vaccine is given at the site of injury rather than give it in IM. So complications কি হতে পারে? It is being derived from horse, so there may be chances of hypersensitivity, ঠিক আছে? So how do you manage a rabies bite? Bite by a rabid animal. Rabid animal, কুকুর কামড়ানো, বেড়াল কামড়ানো, বেড়াল আছড়ানো, এসব আসে না? So first you clean the wound by, বল, একটু জোরে বল। iodine or alcohol or simply by soap, ঠিক আছে? in কি করে করে? in a running water, ঠিক আছে? then you give this Antisera at the site of bite, then you give the post exposure prophylaxis, ঠিক আছে? These bites should never be sutured, ঠিক আছে? they should be covered by a moist gauze or moist cloth. এগুলো এতে পড়ানো হয় না কিছু মাইক্রোবায়োলজিতে? তাহলে কেউ কিছু বলছে না কেন? এতদিন তো র্যাবিস হয়ে যাওয়ার কথা। So humanized rabies immunoglobulin, ঠিক আছে? What will be the advantage? Earlier it was immunoglobulin obtained from horse. This is humanized. Advantage কি হবে? বল No, the chance of hypersensitivity will be much lower than that of horse. ঠিক আছে, but it will also be expensive. So longer acting, superior to equine rabies immunoglobulin, because chances of hypersensitivity is low. So it's a form of passive immunity. What is passive immunity? বল ভ্যাকসিনেশন কি হলো? আচ্ছা, general care of wound, wash under running water with soap for 5 minutes, apply antiseptic like alcohol. She has also said iodine, this can also be applied. Then rabies immunoglobulin applied locally, avoid suturing, post exposure prophylaxis of rabies. ঠিক আছে, এটা কি পোস্ট এক্সপোজার প্রোফাইল্যাক্সিস কি রেজিমটা বল? পোস্ট এক্সপোজার প্রোফাইল্যাক্সিস অফ র্যাবিস রেজিমটা বল, এইমাত্র বললাম, বসেই আছিস। Polyvalent anti-snake venom serum. So what do you mean by polyvalent? What do you mean by polyvalent? Polyvalent means acts against the venom of more than one snake. ঠিক আছে, that is polyvalent. কি কি স্নেকের এগেইনস্টে অ্যাক্ট করে? কোবরা, রাসেল ভাইপার, রাসেল ভাইপার মানে চন্দ্রবোড়া, ঠিক আছে, আর ডেঞ্জারাস স্নেক বাইট সস স্কেল ভাইপার, ক্রেট, ক্রেট মানে চিতি সাপ, ঠিক আছে, শাখা চিতি যেটা বলে, that is crate. So equine serum, that is produced the same way. Horse is injected with small doses of venom, it starts to produce the antibody, horse serum is collected and purified, samples are purified, immunoglobulins are taken. So what may be the adverse effect? Pritam, bol, what may be the adverse effect? Anaphylaxis, because it is derived from horse. ঠিক আছে, other antiserum, tetanus immunoglobulin, hepatitis B immunoglobulin, gas ganging antitoxin, diphtheria antitoxin. So these are all immunoglobulin obtained from some animal which has been immunized by the toxin. So something about Covaxin and Covishield. So Covaxin কোথায় ইউজ করা হয়? COVID-19, ঠিক আছে। So Covaxin is a inactivated COVID-19 virus, and Covishield, the Covishield, in Covishield, part of the COVID-19 DNA that synthesize spike protein is being introduced into the adenovirus of chimpanzee adenovirus. Alright, that is being injected. Now when it is being injected, it is taken up by macrophages. This DNA starts to synthesize spike protein within the macrophage. This DNA that is being incorporated within the adenovirus, they goes into the macrophage and starts producing spike protein. Now this spike protein leads to antibody immune response. ঠিক আছে, so that's how Covishield and Covaxin produces immunity. So another dengue virus Q dengue has been recently approved by DCGI. ঠিক আছে? So it consists a polyvalent vaccine. So attenuated tetravalent vaccine. How many types of dengue virus are there? So there are 4 types: Den 1, Den 2, Den 3, Den 4. ঠিক আছে? What is the pathology of dengue virus? কেউ না? What is the complication caused by dengue virus? Huh? Dengue shock syndrome. ঠিক আছে? Basically what happens when there is first there is infection by one type of dengue virus, then there may be subsequent infection by another type of dengue virus. So what happens when there is a second dengue virus infection? The body cannot mount an immune response against that second virus. So that second infection becomes may manifest as dengue shock syndrome, like Wahid has told. কি হয় shock syndrome এ? Hypotension আর shock, হ্যাঁ কি কমে যায়? There will be bleeding tendencies. ঠিক আছে? Rashes, petechial rashes, hemorrhage হতে থাকবে। ঠিক আছে? Bleeding through the mouth, through the anal canal. So that's what happens in dengue shock syndrome. Now this can be used in from age group 4 years to 60 years. No pre-vaccination screening is required. This is a plus point for this Q dengue. There are other vaccine also. I am discussing to the most important one. ঠিক আছে?